And now I'm here with Whende Carroll, who is the Director of Clinical Optimization at Contigo Health and founder of NurseEvolution.org. I am thrilled to see you, Whende. I've been lucky enough to have a conversation with you before and gotten a little bit of understanding of what you're doing, but why don't we tell the world what Nurse Evolution is?
Sure. It is an information hub that's been established for nurses to learn about health IT, advanced data analytics, and then also innovation concepts in nursing. So I established it because when I was working in the AI space, I found that nurses just didn't know a lot about data analytics. And the nurses we were working with didn't know a lot about IT, and that a lot of nurses were not in the life cycle process in the production process of building out tools and solutions and models and processes that were innovative. A lot of nurses are very interested in it, so that's why I established
What
Nurse
was the
Evolution.
disconnect? Why do you think that is, that nurses weren't included in that role?
I think because a lot of times we have a problem with visibility and showing our value. And a lot of times in startups and in other companies that are creating these products, they don't realize they need the voice of the nurse. And we need to be able to express and tell our bumper sticker about what our value is. And that's something that I try to do with Nurse Evolution as well, is bring thought leadership for nurses in the innovation space.
It's funny because yesterday I had an opportunity to interview a woman named Renee Lepac, who was a nurse in informatics. And when we were talking about the value of nurses, we spoke about, the fact of trying to establish all the things they do. And one thing that they brought up is the power of their continuity. So that in light that this doctor comes in and this person changes that they're not only there for the patient, holding the hand and being emotional, which is something that you assume a nurse does, but also is able to really monitor on a level that's super important. So besides the continuity, when you think about keeping a patient healthy, what else does that continuity do for a nurse in terms of what goes into her mind and what she can output for others?
Sure. Well, when I think about continuity, I think about the continuity of care. And people tend to think that nurses are just working in units and in hospitals. And what nurses are doing more now with their education and what we know even about technology, that nurses are looking at the big picture. They're looking at, from this time that the patient gets into a hospital or a clinic, what's going to happen afterwards? What is going to happen to a patient in the hospital who is going to be sent home or out into the community, or if they're going to go to a long-term care facility? What are all the steps we need to take?
Those micro decisions are always on her mind, or his mind, right?
Yes, exactly.
So give me an example of how you can take that brain power and actually put it outwards into things not only in patient care, but products.
Sure. I think we are, as nurses, the voice of the patient. And I'd like to see more nurses on product teams where their voice is heard and they are in the full life cycle production, from inception to actually being able to create the product, creating the roadmaps, and then also doing the testing, make sure it's safeguarded.
And work smartly. Like, can you give an anecdote of something that a nurse created that maybe somebody didn't think about?
Sure. There is a company, CEO I just met, of a nurse-led innovation company that has done a couple of things. It helps with documentation burden for nurses, but then also it helps give nurses more time to spend with the patient. It's a computer vision product that uses machine learning and AI as the nurse is speaking to take natural language processing and document into the patient record. And then they look at the draft and then they okay it or not and say this is right, or correct it, and then put it into the chart. And it's such a time saver. patients might look at that and see something on a nurse and wonder what the is
hey,
happening.
Is that Google Glass? Like,
yeah,
what's going on over
exactly.
there?
Is this virtual reality?
Right.
But what they're doing is they're making sure that the record is accurate, because nurses really pick up on a lot when they're just talking to patients.
Right, of course. I mean, those conversations of showing vulnerability, having observations in the minute about something that's happening, and them having the time to read it and absorb it and share it with others. The other thing I think about is, in as much as hospital systems and organizations are always trying to build new products, the one thing I'm not going to give them high grades for is good UI, UX, user experience. And I have to believe that there are nurses who, just by knowing the process, do a really good job. Do you have an example of that?
I do have an example of that. A nurse consultant I know worked with a company who built a stethoscope that patients were supposed to take home with them and be able to take an EKG. She was concerned when she used the product about a couple of things. First off, that the people 75 years old, let's just give that an example, wouldn't be able to take it home and use it because the power button wasn't in the right place, the instructions weren't correct for how you place it, and then also on the app that they were supposed to use, they were supposed to get a dashboard. So that was patient.
I mean,
that
a
was
whole
for
other
the
thing.
patient.
Now you have to have a smartphone? Mm-hmm. Wow.
Yeah, exactly. And then the hospital or the provider is supposed to have a dashboard as well of all these analytics. And when we took a look at that, it was there was a lot to be desired.
The nurse is like, hey, no bueno.
A lot of
no way,
opportunities.
Jose. Right, good for you. Well, look, I want to believe in the time of COVID that this is a place where nurses have been lifted. I'm looking forward to watching kind of their role and the perception of the role catapult into new dimensions. So, Whende, I'm really happy you're here. It's great to meet you in person.
You too.
And thank you for being here.